Dr. Seth Grossman. I'm an orthopedic spine surgeon. So after disc replacement surgery, again, surgery typically takes between an hour and 2 hours. It can usually be done as an outpatient procedure, meaning you go into the hospital in the morning, and then you can usually go home later that day. After surgery, expect to be groggy after surgery, maybe a little nauseous from the anesthesia. Definitely going to have some pain at the incision site in your neck, sore throat, things like that. But those should hopefully resolve within a week or two. The symptoms which you came in for the surgery was typically a pinched nerve or pressure on the spinal cord, numbness, tingling in the fingers, or radiating pain should very quickly start to dissipate. Should be up and around. Again, my patients are up and walking within a day of surgery, and usually after a few weeks, a lot of these symptoms are starting to resolve, and patients can usually return to full activity within a month or so.